What I want to talk today about is the challenges facing our health and social care system here in South Devon and Torbay, and what we as a CCG working with our partners are going to do about it. Let's first of all identify what are the challenges that face us. We know that we have a population which is living longer. It lives with more long-term conditions. By that I mean diabetes, obesity, heart disease. And we also know that there are challenges about getting a workforce that will come and deliver that for our communities. And what I mean by that is I mean recruiting doctors, nurses, physiotherapists, occupational therapists and carers. So it's across the whole health and social care provision. So what can we do about this? Well, we will be tackling this in 4 specific areas. The first is around living healthy lives. We know that if people take exercise, eat well, live in good housing, have jobs, that this impacts on their health outcomes. And if we can support people to live healthy lives, what we call the prevention agenda, which we work with our public health colleagues to help deliver, then actually that, for one thing, gives people a physical and mental well-being, because I think mental health is important here as well, but also it actually takes the pressure off the provision of services. So that's about prevention. The second area is about self-care. More and more people want to take responsibility for their own health. I have children myself, and they are keen to access information through apps or other fields, and we need to help people do that. So part of this is using technology appropriately. We also are developing the 111 telephone service such that people can access clinical information when they need it. And we also are working in partnership with the Trust and Social Care such that health navigators, care coordinators and the voluntary sector can help support people to manage their own long-term conditions. The next step in the journey of care is about delivering services in the community. We are in discussions at the moment with the population around how community hospitals and community services should be delivered. This is about where you're looked after in terms of your bed. We believe, and much evidence sits behind it, that the best place for your care, the best bed, is your own bed. And if we can deliver that by supporting with nurses, OTs, physios, carers, then this is the best place to deliver care. And we are working with the Trust to ensure that those services are provided close to your home and working with your GP and primary care. Lastly is what we call the acute services, and that's when you really need that expertise of doctors and nurses and access to tests and investigations which just aren't available in the community. So that's about having a resilient and reliable hospital. We use mostly Torbay Hospital here, but there are other services which people will sometimes go to in Plymouth and Exeter, and that's making sure that those services are efficient, safe and of an absolute high quality, and that we can afford to keep delivering them. So these are the 4 areas which we're tackling in the CCG. We call this our 4 phases of care, and all across our communities and the population we will want to talk to people about the 4 phases of care, how it's being delivered, what you think of it and how things can be improved.